Hello. Today we will be talking about Roy's adaptation model of nursing. The Roy's adaptation model of nursing views the person as an adaptive system in constant interaction with an internal and external environment. The environment is the source of a variety of stimuli that either threaten or promote the person's unique wholeness. The person's major task is to maintain integrity in the face of these environmental stimuli. Integrity is the degree of wholeness achieved by adapting to changes in needs. Roy and Andrews define health as a state and process of being and becoming an integrated and whole person. Health is a reflection of how successful an individual has adapted to the environmental stimuli. The goal of nursing, therefore, is to help a person achieve adaptation by helping the person survive, grow, produce, and master. Adaptation leads to optimum health and well-being, to the highest quality of life possible, and to death with dignity. Adaptation enables the person to find meaning and purpose in life and to become an integrated whole. Critical thinking in a nursing practice with Roy's model, the nursing process is a goal-oriented, problem-solving approach to guide the provision of comprehensive, competent nursing care to a person or group of persons. Roy has conceptualized the nursing process to comprise the following 6 stimulus, ongoing and dynamic steps. These are assessment of behavior, assessment of stimuli, nursing diagnosis, goal setting, intervention, and evaluation. To start, assessment of behavior. From Roy's perspective, behavior is an action or a reaction to a stimulus. A behavior may be observable or non-observable. Assessment of stimuli is any change in the internal or external environment that induces a response in the adaptive system. The nursing diagnosis is a nurse's education and experience enabling him or her to make an expert judgment regarding healthcare and adaptive needs of the client. Goal setting. Goal setting focuses on promoting adaptive behavior. Together, the nurse and the client or patient agree on clear statements about desired behavior outcomes of nursing care. Interventions, according to Andrew and Roy, are focusing on the manner in which goals are attained. Evaluation in the Roy's adaptation model, evaluation consists of one question: has the person moved towards adaptation? In Roy's adaptation model, the meta-paragrams are person, environment, health, and nursing. The Roy adaptation model sees the person as a biopsychosocial being in continuous interaction with a changing environment. The environment includes focal, contextual, and residual stimuli. As we discussed earlier, health is an anticipated dimension of human life and represents a health-disease continuum. Roy defines health as the process of being and becoming an integrated and complete person. Roy's model of nursing defined nursing as a science and the adaptation of this scientific knowledge into the practice of nursing. According to Roy's adaptation model, the purpose of nursing is to ensure adaptation. The 4 modes of adaptation defined in Roy's adaptation model are physiologic, self-concept, role function, and interdisciplinary modes. Nurses help to meet these needs of the individuals in these modes of adaptation. In addition, this theory fits well with the practice setting that I work in now because we have noticed the environmental stimuli affecting youth in our communities. If the youth in our communities do not have the support needed to be able to thrive and be healthy, they also cannot learn properly. So with the work setting that I am in, we work highly with our community families and children to make sure they have all the necessary resources and support to be able to grow and be successful. So I would say that we are meeting them in their environmental stimuli to hopefully improve their health and academic outcomes. Um, Two examples of how concepts or propositions from this theory could directly influence patient care and what I do is in the community, there are a lot of families that, one, do not know how to navigate the healthcare system. Two, they don't know what resources are available to them. And three, they don't have the education needed to be able to ask or look for these resources. So part of what I do is make sure we're doing family outreach. We connect with the academic experts, so we connect with schools to identify kids that may have some needs, or maybe they don't have needs and they just need somebody to talk to. But most of the time, there's something that we can help with. We make sure that we are telling them the resources that they have. We make sure that we are educating them and giving them the opportunity to ask us questions and giving them that one-on-one interaction. Those individuals who don't have healthcare coverage, we're assisting them with getting healthcare coverage. We are essentially any barrier that they are coming into, we want to make sure that we are overcoming those barriers. We want to fill the gaps. So we want to make sure we are that link between the schools and the hospital as well as the parents to make sure that everyone is being taken care of and able to grow. Thank you so much for listening. Have a good day.